Hi everybody, welcome back. Today's a very special day because of the guest that we have with us today. Her name is Patricia. I'm going to introduce her in a little bit. But I want to lead into this interview by just kind of going through some stuff that I've talked about before. As many of you know, Ty Bollinger has the Truth About Cancer series. That's a 9-segment series that Linda and I have listened to at various times, and we've got through it all. But I remember in the second segment, we were driving home from Abilene, I remember this, and it was a lady doctor who said something to the effect of, consider living with this cancer, which I thought was pretty novel, because the general approach, I think, in this country to cancer is cut it, burn it, obliterate it, try whatever you can do to totally eliminate the cancer. And of course, as you guys know, the cancer statistics in this country are very unimpressive, right? I mean, the prevalence is the same, the incidence is the same, the survival rate's the same. Every year we got people out, running with pink ribbons around, but nothing's going on. Nobody's getting any better. So what if we changed the approach from obliterate it, and sometimes obliterate the patient in the meantime? Ty Bollinger believes that both of his parents died not from their cancer, but from chemotherapy that was given to them to treat their cancer. To living with the disease, sort of like you live with high blood pressure, you live and you take a blood pressure pill, or you have diabetes and you take a diabetes pill. We're wanting people to consider living with their cancer, which brings us to today's patient. Her name is Patricia, and I want her to share her story. Where she was before she came here, what she's done since she's been here, and in my opinion, she's a miracle, and I hope you guys will enjoy her story. So, Patricia, take it from wherever you want to begin.
Well, it started in February of 13. I was diagnosed with melanoma in my right eye, and they put a radiation plaque in. And on Friday, took it out on Monday, and thought that everything was okay until 2 years later, and it was back. So they put 2 plaques in my eye instead of 1, about the size of a quarter. And then, so far, I haven't had it any other time in my eye, but it metastasized to my liver. And they found that. I went in for a liver biopsy, MRIs, and then my option was to go, they were going to send me to an oncologist. I did go to an oncologist. He told me that there was no chemo treatment for this. And he suggested immune therapy, although he would check with MD Anderson or some of the cancer places to be sure that there wasn't an experimental drug or something that he didn't know about. There was no experimental drug. There was no cure for it. I agreed at that time to go through with the treatments. He told me that I would probably maybe live 6 months, possibly a year, but more like 6 months. I didn't like that. I wasn't satisfied with that. I'm a nurse. I was a registered nurse. I know what chemo does to you. I've seen it. I've regulated it for people. I just wasn't pleased, and I wasn't pleased with the 6 months thing. So I decided to look further. And I had some scouts out helping me look. And we found Dr. G. And I called and got an appointment. And I told him that everything that I had read about the immune therapy that the oncologist had told me about just scared me to death. I couldn't do it. If I've got 6 months, I don't want to be sick all the time. I want to be up and running with my grandkids and my kids. I want to try to make the best that I can be for that 6 months. So I decided I wasn't going with the oncologist at all. So I called him and I canceled all my treatment there. And I came and got in here, found the support, the love, the compassion that I was really looking for, that I really needed at that time. And I've done everything they've said. I haven't cheated on my diet. I've done everything that they've said. And it's, so far, it's good. I know there's going to be a bumpy road, but, you know, I'll go for it. I'm ready to fight. I'm ready to fight this. I'm going to, you know, I've got kids and grandkids and a husband, and I'm going to fight it. And to me, this is an easier way to do it than seeing with the chemo, which there was no chemo, but there was an immune therapy. But I read the side effects, and it literally scared me to death like chemo. So I have not been sick. I have kept up everything that I was doing before. I mean, I clean the garage, I clean my house, I don't have a maid.
Mow the lawn.
I mow the yard, I do everything that I did before. I keep grandkids, and if I want to stay up and clean house all night, I stay up and clean house.
Yeah, so again, a couple points that she's making. Number one, injured tissues heal with nutrients, not drugs. Second, through God, all things are possible.
Absolutely.
You know, ultimately, you know, Patricia's faith is at the center of this miracle, and the rest of us just get around, you know, stand around and support it. But, you know, that's, I think, what's making this thing manifest, and here she is, this, you know, this living miracle with, you know, metastatic malignant melanoma. And I wanted to bring this case forward to just show you what inspiration looks like, what courage looks like, what a miracle looks like, and every day we're here is another day that it grows. Amen.
Yeah. Amen.
So we're just, you know, we're gonna keep on trucking, and you know, we'll see how we do. So thank you for tuning in, and please share this video with friends and family. Have a good day.